Barbara, Randy, can you guys advise?
I would say because it's globally being recorded, I think that maybe took away the option for everybody to record individually. So we could do one of two things. I think you can either do a new send out of link, which probably is not a good thing, or since we're recording it globally, we can just send it out as is to everybody once it's done.
Will that work for everybody if we just send it out as soon as we're done? What we're recording, which we won't edit, we'll just give you what we recorded that you heard today.
Or something, or a link to download.
We'll send a link to download.
Okay. Yeah, that works. Thanks.
Will that work for everybody?
Yeah, that works for me.
Okay. Well, we will get started. Thanks everybody for being here today. I'm Susan Gregg, Director of Media Relations for UW Medicine. We're going to start off with Dr. Geoff Baird, who's the chair of Laboratory Medicine and Pathology at the University of Washington School of Medicine. And he's going to share some opening remarks just about our current situation with our testing location sites. As you know, it's been very busy, so he's going to sort of give you the current state of affairs with that. And then we'll open it up for questions and answers after that. And if everybody can just, you know, you can either do a chat and introduce yourself through that, or you can ask on audio as well. So Geoff, Dr. Baird, if you can kick it off with opening remarks.
Thanks very much, Susan. And thank you all for joining today. I wanted to have this opportunity to speak to you all to let you know how the testing sites have been running. As you're probably aware, UW Medicine operates many community testing sites across our region in partnership with the city of Seattle and King County. As Omicron surge has risen and risen, the positive rate has gone way up. I was just informed by our most recent download of data that the Tuesday's positive rate, for example, at the county's Auburn collection site was 49%. Which is just astronomically high compared to where we have been. In between surges, we have oftentimes seen sites across Seattle at 5 to 10% positive. And at previous peaks, we have seen positive rates of 20 to 25%. The reason why the positive rates are important to us is that we test our samples by pooling, which is a very common technique that's used in clinical laboratories all across the country to increase to increase capacity. And what this means is, in a normal situation, we would take 4 or 5 samples. We would take a small portion of each, mix them into one sample, and then test that sample once. If that sample was negative, all of those samples would be considered negative because the test is extremely sensitive. And so we would really have done the work of 4 tests or 5 tests with just one test. So it was really a way to increase capacity. The problem when the positive test rate gets very high, though, is that all of the pools are positive. You know, if 1 or 2 of them are always going to be positive, we would still have to then go back and test all 4 individually to see which one was positive. And so we can't do pooling anymore. And what that does is it really decreases our capacity. And so what we are going to have to do at our UW Medicine sites throughout the region, and I'll list where we're going to have to do this, we're going to have to reduce our testing availability. And so in 2 ways. One is we are going to have to, through our appointment system, limit testing appointments to those who have symptoms of a respiratory illness or those who have a known exposure to someone who is positive for COVID-19. And we will have to pause taking appointments for people without symptoms, including before travel or gatherings, et cetera, until such time as the positive rate decreases. Also, while we have approximately, I think 12 of the community sites that we are doing the testing for across the region, the 9 of them we will continue to operate with these appointment limitations, but 3 of them, including our community testing sites at Ballard, the one at Seattle City Hall and the one at Sammamish, those community sites will have to be closed temporarily. And we will continue to monitor our positive rates as the surge continues. And once the positive rates drop down again, we will then open them up and increase our capacity. So this is probably going to mean that our overall testing capacity, which we have been receiving on the order of 10 to 15,000 specimens a day for most of December, with a peak right before Christmas of about 20,000 tests. We will probably only have the capacity for somewhere between 8 to 12,000 tests a day. And so we'll have to limit that. The other reason that it's important to mention that we're limiting this is we could accept more tests, but we wouldn't get to them in a meaningful time. And I think that's a really important consideration that we have been using to make our decisions about capacity and testing all the way back since March 2020, when we were really the only high capacity testing site in the region. We have been targeting 24-hour turnaround time or less and hitting that goal for most of COVID, actually. But in the last few days, we've gotten to the point where our turnaround times have sometimes exceeded 2 days. And medically speaking, a COVID test that is not back for several days, it just isn't terribly meaningful, because someone could go on and spread the virus, and they wouldn't have the important information they need to make the decision about whether or not to quarantine or whether or not contacts should isolate, et cetera. So we are making this decision because we want to keep the medical value of the testing intact, and make it so that the testing that is there for the people who need it the most, those are the symptomatic people and those who've been exposed to someone with COVID, they have the information they need in a timely manner, rather than us just accumulating a very large backlog of samples that aren't going to be reported out. So I think with that, Susan, I would just, that was the message I wanted to deliver. I think I would just open it up now for questions. I don't know if you want to moderate that or not.
Yeah, why don't we go ahead? People can either chat or feel free to ask Geoff a question on audio.
Okay, I have a question in the chat, which is wondering what positivity rate we'd need to see in order to reopen these testing spots. So we have actually been able to operate with positivity rates in some spots over 25%, because in other spots, our positivity rate has been 3 to 5%. And so we actually every single day, and in fact, multiple times a day on different shifts, look at the positive rates and can blend specimens from different sites based on what the previous day's positivity was to get us to the level. Overall, what we need to see is a level that is on average below 10 to 15%. And we're right now, the most recent download of data I got from the city of Seattle and county collection sites en masse was that our sort of overall positive rate was around 25%. So it will need to go down by about half from where it's at right now for us globally to be able to operate once again at full strength. However, what I'll say is we monitor this every single day. And so what I just told you about the limits on these, this could change in a matter of days, but we're going to start doing this on January 4th. And then monitor every day from then. We're announcing it now because we didn't want to cut off appointments that are already, people already have. But after January 4th is the time that we will be making this change. Someone has now asked Anna Boyko Wyrek has said, is it fair to say that UW testing has been overwhelmed by the demand for tests from asymptomatic people? So actually, no, that isn't the case. It's the high positivity rate that has caused the problem. The lower positivity rates that happen that are seen in asymptomatic people, again, are not a problem for our capacity, because we're able to pool those and generate those answers very efficiently and quickly. But when the positive rates in some sites exceed 40%, as I said, and I believe some other areas in the southern areas of King County have exceeded 40% in the past few days, that is what is actually causing the capacity problem. Tammy Mutaza asks, hi, Dr. Baird, thank you so much. I know you guys have been running amazing testing sites. if you're reducing capacity, what do you advise people who don't have symptoms do, but they want to stay safe? Right now, with very, very high positivity rates, I think you said for asymptomatic people, one thing I could say is if it becomes very, very difficult to get a test, you should probably just consider symptoms to be an indicator that you could very well have it. I mean, what we're seeing is now 30, maybe 40, almost 50% of those cases in some regions are actually COVID. But for asymptomatic people, again, I think it's important to remember, and this has been something that's been true back since March 2022, is that testing is one tool in the tool belt that our society can use to fight against COVID, but vaccines and distancing and not going to gatherings and not traveling are actually the mainstay of what we can do. Right now, the most important thing is, as I said, vaccines and not actually doing those social events. COVID is not transmitted because of a lack of testing. COVID is transmitted by human behavior with people interacting and being in close contact. So that's the important thing to do. Dee with Cairo 7 says, do you have a recommendation about rapid tests? FDA says many do not catch Omicron. Rapid testing, I think, is a great approach for symptomatic carriage. The data on how those tests work shows that they are very sensitive, not actually as sensitive as PCR, but very close, within 90% or so of the sensitivity of PCR testing if you're symptomatic. But below that, it actually drops off quite precipitously. And while there are some advocates out there who think that we should be doing rapid testing every single day, there are obvious limitations to getting us there. And the tests are also not that sensitive for asymptomatic individuals. And so antigen tests, those rapid tests, can give you a false sense of security, because you could test negative, but you could actually right at that time be infectious, or later, 6 hours later or the next day, you could be infectious. And so it becomes a bit of a circular thing. How often do you test? You have to test every hour to see if how you're doing. That's obviously not practical. So the recommendation I would have for antigen testing is, if you have them and you do have some symptoms, it would actually be a very reasonable approach to doing that. But before a gathering, to see, is this gathering to be going to be safe? My recommendation would be is actually rethink having that gathering right now. As for the data that says that it does not catch Omicron, that is relatively new data. And again, all of these tests, while they give you a yes or no result, you get 1 stripe or 2 stripes, or we report a yes or no by PCR. They are all actually quantitative, meaning they measure how much is there, and then over a threshold they give a yes, or below a threshold they give a no. And so the question with Omicron would be, has that threshold changed? It's very likely that if you had a lot of Omicron, that most of our tests are going to test positive for it. So I don't think that the situation is at all the case that antigen tests aren't useful right now. I think still for symptomatic cases, I think it's probably very useful.
Just a quick follow-up. It's Dee still with Cairo on that. So a lot of people have been getting the WA notification saying you've been exposed or potentially exposed. For those cases, people should still try to get a PCR test.
I definitely recommend getting a PCR test, because in those cases, if you've been exposed, if you're symptomatic already, then I think that an antigen test would be a good idea if you had it. But if you're not symptomatic, you could be in the early stages at that point. And yes, that's why we are leaving appointments available at our community sites for those specific cases, because I think it's very important to do what we can to limit that spread.
Thank you.
Hey, Geoff, do you want to explain the additional testing that happens, walk through the process of?
Sure.
Because I think that's important for people to understand.
You mean the pooling testing, Susan?
Yeah, well, the additional testing required to actually confirm a positive COVID
Yeah,
test.
so what we do is we take for our community testing sites, when we have been doing pooling, what we would do is we would collect the samples that come with this, that are the swab is collected, the virus is put comes off the swab into a tube of a liquid that's a preservative liquid. We then collect those liquid samples, we combine small parts of them using a big robot that is called a liquid handler that combines all those. We test those mixed samples, and then if one of those mixed pools is positive, we then have that robot liquid handler then spit us back out those 4 individual samples, and then we have to go put those samples individually onto another robot that then tests them all again. So there's a whole second set of testing that goes on for positives there, and which is why the capacity is so challenging when there's so many positives, if we just have to do these. When we don't do pooling, we just now have to take all of those samples ahead of time and run them one by one on the large automated robotic testing platforms. And that actually also takes a lot of time. Another issue here, you may have a question, is it an instrument problem? It's not actually really an instrument problem. It's more of a staffing problem because it's just so much work to do. It's very difficult to staff clinical laboratories all across the United States right now. Since March 2020, we have actually been hiring staff from all around the country who are willing to come to Seattle and work for us. But it is incredibly hard to find new medical laboratory scientists who are able to work for us because they're working somewhere else right now. Just like many of our other industries in medical and non-medical fields are having hiring crises right now, so are we too in that area. I see a question from Aaron Zuko. Was the 49% positivity rate at Auburn pretty typical for what you've been seeing at sites across the area, or was that extraneous or abnormal? The day before, there had been similar positivities in the low 40s, I believe in Tukwila and maybe also at Auburn. So no, it has just been one of these things where it's been creeping up and up and up and up. So it wasn't unexpected, but it is still the highest that I've ever seen in our region. It's really very high. Elise Takahama asks, one more, will limiting testing affect ability to accurately see Omicron surge, especially because so many other county sites have been closed due to snow, et cetera, this week? So we'll still be able to see the percent positive, which is a very good surrogate for sort of what's out there. But we will not have as much, obviously, of an accurate count if some people who may have actually had it otherwise do not come to get tested. So we will not see as many. But then again, we always have known that testing statistics that you see, across the country that are assembled in all the major media outlets, they've always been an undercount, sometimes by, maybe more than twofold, simply because everyone who gets this is not getting a test. And then the other consideration is many of the home antigen tests, the rapid tests that are getting, they get a positive result, but no one is obliged to then report that to public health. We would prefer that they do for our statistics so that we understand where all those positives are. But that is one of the disadvantages of home testing, is that we don't actually always know if that test has been positive or not.
Any other questions from anybody? I don't see any more on the chat.
It's Dee Dee again. I have a quick one. Do you have any thoughts on the new CDC guidance that talks about people who are asymptomatic who've tested positive only needing to quarantine for 5 days? I know there's been some concern among some doctors about further fueling the spread despite the masking guidance.
This is a case where I think I'm just going to have to sort of punt to my colleagues in infectious disease and in public health. And my expertise lies in laboratory testing and not really in the sort of the public health recommendations around that. What I can tell you is that UW Medicine, today in my organization, we have maintained the previous sort of guidance for our own site, and we are reviewing and considering whether or not we should go along with that. But we have not made a decision yet on that at UW Medicine, and I am not really the expert, and I wouldn't be the person in our own system even to make that decision. So I don't really have an official answer for you on that.
Thank you. And then just final recap. So bottom line is, I mean, you know, there will be a lot of, we won't be able to see the total numbers, especially with this new change in testing availability. We won't be able to see the total numbers of cases that are coming in through the UW Medicine test sites. And, you know, there's going to be a lot of cases that are missed.
There's going to be some, as I said, we will still be doing somewhere between 8 to 12,000 tests a day. However, you know, we have been getting 10 to 15,000 requests or, you know, samples from most of our sites. So proportionally, that's the diminution that you would expect. So we would not see an enormous decrease. And as I said, we will also be able to infer for public health reasons, for public health purposes, what the percentage positive is in all these sites too. Tammy Mutaza, you have a question?
Yes, hi, Dr. Baird. Thanks again so much for your time. You know, I understand what you guys are saying, but I think a lot of people, you know, who are watching are going to be like, you know what, I'm trying to get tested to continue living my life and to be safe. So they're reducing capacity. I mean, it's kind of hard for people, I guess, to hear, you know, like we're reducing capacity unless you have symptoms or you've been exposed. So that's why I'd ask, like, what do you advise people to do? And a lot of people don't want to change their behavior, even though they should, right? I don't know. I think it's just, it's tough to hear, right? Yeah.
I agree with you that this is frustrating, and I count as one of the more frustrating. I obviously, you know, this isn't an announcement that I'd like to make, and we're going to be trying to get back to our normal testing capacity as soon as we can. We are in the midst of the worst public health disaster in the history of humanity. And, you know, I mean, in terms of raw numbers of people that have been infected and people that have died. And so it's important to go back to remind ourselves that, you know, this isn't really an inconvenience. This is a serious public health problem right now. And I think that, yes, people do want to go back and live out their lives. I certainly want to do the same thing too. But we as a society end up having to make some sacrifices. And that there aren't too many ways around this. There really isn't, I think, a great, robust testing strategy for dealing with the absolute peak of, you know, an incredibly infectious global pandemic viral agent like this. That there aren't a lot of solutions. Any solution that I could have come up with for the laboratory back in March of 2020 that was good until now, any other one might have failed with some other, you know, mode of failure too. And we're, as I said, we're not failing here. What we're doing is we're marginally reducing our capacity right now, which will be largely inconvenient, I realize. And it may actually end up causing some people to, you know, decide maybe I won't end up going on that trip, or maybe I won't ending up attending that gathering. And I think that might be that's probably good public health advice, regardless of the, you know, the extreme positivity rates right now.
Thank you.
And what have we done? I think we've done to date over 4 million COVID-19 samples.
We just 2 or 3 days ago, we hit 4 million tests that we've done for our community and our state at UW Medicine. So we have been doing an awful lot, I think, to help out. And this is just this time just to get us through, you know, this next surge. We will have to just, yeah, modestly change our capacity.
Any last questions for Geoff?
If not, thank you so much for all of your attention and for joining us. Thank you so much.
Thank you so much for your time. We really appreciate it.
Okay.
And we will send out the recording and then just a statement that summarizes what Geoff has said for everybody.
Thank you all.
Thank you.
Thank you.
Bye-bye.
Thank you.
Recording stopped.